Hello, everyone. It's Friday, October the 30th. This is a tough day right here. We've lost 15 more additional West Virginians. That brings a total death toll in West Virginia to 451 people. Like we said, this thing is traveling across all of our country at this time, and we need to continue to do any and everything we possibly can. You see, if you're watching the newscast, there's a maybe earlier than what I really feel in my gut that they're going to be, but with that, what does all this tell us? And it tells us just simply this. This is bad all across our country. It is absolutely time for more and more concern to be more cautious and to absolutely do everything in your power to be able to wear your mask and absolutely do the right things. And right behind that, we're very, very hopeful of the promising news in regard to a vaccine. So I'd say it's three things. I'd say it is no question, it is here. It is a fall type flu season that is compounding this situation. It is telling us to try to be more careful if we can be. And on top of all that, we've got to know that we have real hope of a vaccine that will put this thing in our rearview mirror. But today we do have 15 additional deaths. I'm going to read each and every one. I hate it like crazy, but the 437th death of 82-year-old female from Kanawha County. The 438th death, a 71-year-old female from Wetzel County. The 439th death, a 73-year-old female from Wetzel County. The 440th death, a 66-year-old female from Wetzel County. The 441st death, a 66-year-old female also from Wetzel County. The 442nd death, a 74-year-old female from Berkeley County. The 443rd death, a 70-year-old male from Kanawha County. The 444th death, a 93-year-old female from Cabell County. The 445th death, a 90-year-old male from Wetzel County. The 446th death, an 84-year-old male from Kanawha County. The 447th death, a 55-year-old male from Cabell County. The 448th death, an 82-year-old female from Mon County. The 449th death, an 83-year-old male from Monongahela County. The 450th death, a 73-year-old female from Fayette County. And the 451st death in West Virginia, an 89-year-old female from Fayette County. Again, this thing is with us, and we've got to continue to do all we can possibly do. Please keep these people in your thoughts and prayers. Don't let them become numbers. Please, please, please hold them close to your heart and think about them right now. We have 524 new cases in the last 24 hours. We're testing more and more and more, and therefore we're finding more and more and more new cases. Ultimately, at the end of the rainbow, this will be the very best tool in the toolbox for us, because if we do not find these people, you think what kind of mess we're going to be in then. We will have Groundhog Day forevermore. But by finding these people, we're helping ourselves, and we're going to get through this, but we've got to find these people. Our daily positivity rate is 3.77. Our cumulative positivity rate is 2.91. We now have active cases of 4,987. We have recovered cases of 18,552. We have 240 people hospitalized. I think that number was 222, and that's moved up to still another record high. Our effective reproduction number is 1.10. Now we're the 17th best in the country. We have one county in red right now, that is Mingo. We have 5 counties in the orange, that's Morgan, Berkeley, Upshur, Wayne, and Wyoming counties. You know, General Hoyer is going to talk about additional steps that we have made in regard to testing in just a few minutes. You see the free testing that's up and where it's at. The orange and the red counties, you know, are counties that we would encourage all the residents, all the kids, everybody there to go get tested. I think, you know, that I have added another ingredient to this, and that is we are going to now aggressively test the red and the orange without question, but we're going to add the gold to that as well. Again, General's going to speak on that in just a few minutes. Our drive-through pharmacy testing at Fruth and Walgreens is going good, but it just can't handle the capacity, and we've got to get people to test. Now let me stop. Let me stop just one second. And let me just say this, because after extensive discussions with Dr. Marsh and on and on and on with everybody, a real live problem in West Virginia, you have got to listen to me. We test more right now, and we find in the last 24 hours that we've got 524 people that are walking around, and probably, if I were to just guess, I'm going to say that 400 plus of them didn't have a clue that they even have it. Now, if that be the case, in 24 hours now, mind you, in 24 hours, if I'm right on the numbers, and we find 400 people that didn't know they even had this, and we're able to isolate them for a little while, do the contact tracing, and we're able to ensure that we stop their spread. What's that mean? What it means really is we're going to save somebody's life, if not a whole bunch of them. Now, just think in the last 24 hours, if we found 400, just think really and truly what we've truly got to do. We've got a situation in a gigantic county in this state, in Berkeley County right now, and we've had pleads from our superintendents and principals and everything else. And the bottom line to the whole thing is what we have got to do to be able to calm Berkeley County down, get us back in school, get us back doing things within our life that we, and be able to protect the residents of that county. What we've got to do is we have got to jack up the testing in a gigantic level. Now that's what we got to do. That's all there is to it. But we got to do this all across our state, West Virginia. And here, I can't be any more brutally honest than just this. When we send 15 or 18 people to an area to be able to test the people, we need the kids, we need the parents, we need every official in those counties to say, we got to go get tested. From when it really boils right down to it, to be brutally honest, we show up in areas to test and have 19 people come out. That's no good. You know, we need the media's help. We need the parents. We need the coaches. We need all the kids. We need the government officials. We need people to understand and encourage and just do what we did in the census. and that is this. We showed up. We showed up. It is a nothing test, an absolute nothing test. And absolutely, at the end of the day, it gives us incredible information. Now, you, West Virginia, you've got to get this, and you've got to get this right this minute. We have to have an avalanche of tests done. The more we test, the more we'll stop this thing. West Virginia, I just read 15 people that died in a day. In one day. Now, I'm going to probably mispronounce this name, but I think it was Sago. Is that correct? You know, where we had the mine disaster? And you think how our hearts and how we just shedded tears, and we absolutely just, it was terrible. It was terrible. You know, it was terrible beyond belief. You know, and in that, I think there was 11 or there was maybe 12 miners that were, you know, that basically were trapped in the mine, and we were trying to get to them, and finally we got to them, and it was thought that they were all alive, but really and truly, they were all dead except one, and that person really had a really, really tough go of it. You think how we poured out our hearts and our love and our support for days with what was going on there. Now, with all of that, I mean, when it really, when it really boils right down to it, we're doing that every day. I just read 15 people that died since Wednesday. Now, come on, West Virginia, you got to go get tested. You have to really show up. And we have got to step it up as far as the amount of testing capabilities that we're going to be able to do. Now, our general will report to you on that, but I have been buck nuts in the last, days about just exactly significantly increasing our testing capabilities. But I am constantly forewarned by Dr. Marsh, and I'm getting sick and tired of listening to him tell me, Governor, the problem is the people aren't showing up. Well, now you're hearing from the governor. The governor's telling you, I don't want to hear from Dr. Marsh telling me that you're not showing up. I want you showing up in every way to get tested. So please, come on. You got to help me, and it will absolutely become the very thing that we need so badly, and that is to be able to try to some way stop this thing. If we stop it, we go back to school, we go back to playing ball, we go back to having our lives. I mean, for crying out loud, we go back to your governor not sitting here reading 15 people have died. So come on, West Virginia. Our Eastern Panhandle testing, I've already been through that, and everything. We're going to be at schools. We're going to be in Berkeley County at Musselman. We're going to be in Jefferson County at Ranson. We're going to be in Morgan County at Warm Springs Middle, and we're going to be at the Ranson Civic Center, Musselman High School, and Warm Springs Middle. And again, I want you to cover us up as far as the testing, the number of people that come out. We have 20 outbreaks, the 82 confirmed cases in our public school system. That's, of course, naturally, it's always 82 too many, but when you look at the numbers, the sheer numbers of students and teachers and service personnel and everything, it is such a fraction of really what we have all across our state. I mean, it's honestly, it is truly almost a safe haven, and it ought to be. It ought to be. We commend our teachers, the administrators, the National Guard, the health departments, and everything else. But really and truly, our schools are a safe spot to be right now. Mathematically, the numbers show us. Today, we have 48 outbreaks in our long-term care facilities. We have 16 outbreaks in our churches in 13 counties, and those counties are Cabell, Doddridge, Kanawha, Mercer, Mingo, Monroe, Nicholas, Putnam, Raleigh, Ritchie, Wayne, Wetzel, and Wyoming counties. You've heard it over and over. A pew in between you, please think 2 or 3 times about this if you're an elderly person about going to church right now. You know, if you get your services online or some other way, it may be better, you know, but just be concerned. I mean, just protect yourself, you know, absolutely protect yourself in that setting. You know, if you choose to go, just really protect yourself. The corrections update is we have no active inmate cases. It's amazing. All 10 of the Martinsburg cases, inmate cases, have now recovered. In corrections, we have 9 staff cases. You got to give it to these people. They're doing a whale of a job, whale of a job. So all those that are working in corrections out there, great work. You're doing a heck of a job. That's all there is to it. Get your flu shots, the flu vaccines out there for you. The grants in the cities are now up to right at $169 million that's gone out or been awarded. We want you to continue to apply. As far as the monies, the $25 million is sitting there to go out and everything to take care of, you know, people's bill from March 1st to July 31st on their utility bills from the standpoint of the electric bill or the natural gas bill, the water bill, the sewage bill and everything. If you're having trouble with that and everything, you haven't received updates and all that, call us. Just call us, and we'll get you directed to the right spot. We want that taken care of if we possibly can. Now, there's some awards here that we want to give out today, and this is a big one right here. But today I am joining our Department of Homeland Security to honor West Virginia County Emergency Managers for their commitment to the challenging call that they have to duty. You know, Secretary Jess Sandy will present the 2020, you know, Department of Homeland Security Freedom Awards to the following recipients. Roger Bryant, Director of the Logan County's Office of Emergency Management. Lou Vargo, Director of the Wheeling, Ohio County Homeland Security and Emergency Management Agency. Tom Hart, Director of Marshall County's Office of Emergency Management. Laura Peace of Harrison County that works as our Director in the Office of Emergency Management. Dean Meadows, the Director of the Wyoming County 911 Center and Office of Emergency Services. Walter Smittle, Director of Jackson County's Office of Emergency Management. I hope I pronounced everybody's name correctly. I congratulate you beyond belief. I thank you. I mean, when it boils right down to it, you know what you've done. You're a hero forevermore. You've stepped up in a pandemic, and you are a hero forevermore. I hope and pray all your family members know what you have done, because what you've done is so, so meaningful. All of our 55 county managers will receive recognition for their teamwork in this incredible pandemic. And you know, I want to thank all of you, county and first responders today, for the great work that you've done in taking care of our people. So from emergency service personnel to our county and our state first responders, and on and on and on, God bless you. Thank you for all you've done, you know, and thank you for all you continue to do. You're heroes, and that's all there is to it. Now, I have one special award, and today I'm joined with General Hoyer and everything to be able to present to Command Sergeant Major Philip R. Cantrell, the West Virginia Distinguished Service Medal. Absolutely, at this time, if they could join us, and I want to show you this right now. This is unbelievable stuff. Unbelievable. Here's the medal right here, and this is the certificate that goes with it. It's great stuff. So, General, if you could join us at this time, and we'll go forward.
Yes, sir, Governor. Thank you. Sergeant Major Cantrell is now up on the screen, and as Governor pointed out, Sergeant Major is retiring with over 32 years of service to our nation and our state. On behalf of all the men and women of the West Virginia National Guard, we thank him for his great service. I want to just tell you a little bit about Sergeant Major. He and his family actually just barely survived the Buffalo Creek flood. He went on to finish school in Logan County and then on the United States military, served a couple of combat tours with the 82nd Airborne, fairly significant efforts in that regard. Sergeant Major, I met him in Washington, D.C., convinced him that he needed to come back to West Virginia and come home and continue to serve the military and his state back here. He and his family accepted that invitation and came back home. To Philip, again, a thank you. Sergeant Major Dusty Jones will be replacing him, and Sergeant Major has the utmost confidence from Governor Justice and I that he'll take on and continue to move forward. But Sergeant Major Cantrell's done great things. He was part of the catalyst that helped get the new Challenge Academy up and running in Montgomery. He's been an exceptional advocate for our Gold Star families. So to Philip, to Sherry, Mandy, and Josh, to the Cantrell family, thank you. Philip, I have to say that I think the most important thing I got out of this is I've got a friend for life, know somebody that I can count on in the future. I greatly appreciate that from you and your family. Governor, we're going to present the traditional belt axe to the Sergeant Major. It is a replica of the belt axe worn at the Battle of Point Pleasant that sits in our state museum. And it takes us back to our history of the West Virginia National Guard, going back to a militia company formed in 1735 and fighting with General Washington and helped to form the Continental Army. And this represents that history. And Sergeant Major, on behalf of all of us, on behalf of the governors, our commander-in-chief, and all the guardsmen, Amy and I and our family, thank you and God bless you.
Thank you, sir. We really appreciate that.
In general, if you could proceed ahead now, and these are my words, absolutely, post the order.
Attention to orders. This service award is presented to Philip Cantrell for outstanding service to the West Virginia National Guard. He is hereby awarded the West Virginia Distinguished Service Medal, presented this day by Governor Jim Justice, Commander-in-Chief, West Virginia National Guard. Sergeant Major, thank you for your great service. God bless you and your family.
Thank you, sir. I appreciate it. It's been an honor.
Thank you, Governor.
Thank you, and thank you, in every way, men. That's great work. Thank you, sir.
All right, thank you, Governor. We'll now move on to comments from members of our panel. We'll go to Dr. Clay Marsh first today, our coronavirus czar.
Well, it's good to be with everybody. Jordan, if you could turn back on the camera.
We are working on it, sir. I think you'll have to enable it on your end as well.
Okay, sounds good. Yep, I'm unable to start the video. Anyway, that's no problem. I want to reinforce what the governor said. I think that it's so important for our state to make sure that we are extra diligent today in committing, as we've seen with the incredible service of Sergeant Major Cantrell and certainly General Hoyer and the National Guard, committing ourselves to service for others in our state. And Sergeant Major Cantrell and General Hoyer and others have done that on the battlefield. Well, we're on a bit of a different type of battlefield today. And I don't want to go on too long on this, but the ways that each one of us can serve each other today is by making sure that we are getting tested. And as the governor said, our goal for our color-coded state alert public health map, which we're also using for school openings and sports and nursing home visitations, et cetera, is really only meant to serve as a bellwether and as an active set of mechanisms to reduce the spread of COVID-19 in each county, in all of our state, and to make it as safe as possible for us to live and thrive together in the state of West Virginia. As we have talked about, we have seen the single highest day, that was yesterday, of positive cases in the United States of America on a single day for the entire COVID pandemic. 88,000 people were tested positive yesterday. We know from research that's going on all throughout our country and world that a small group of people spread to others. And we know today more about this group of people, these so-called super spreaders. They're people whose anatomy and the environment that causes people to speak louder, to sing, to breathe more heavily. Those are the environments that starts to increase aerosolization from people with the right anatomy. And that increased aerosolization, the smaller particles that stay airborne longer, particularly in indoor environments with ventilation systems that may not be, as good as outdoor environments, very few are, but that's the situation that you can spread and catch COVID-19. And we know today that the ages of people that are getting infected is going up. And we're seeing people going from the 20s and 30s to be the dominant people infected to now people in their 50s and 60s and 70s. We also know that more people are hospitalized today than we've seen in the last 3 or 4 months. And we also know that the number of deaths is starting to steadily increase. And this is all happening at a time we're going into the winter where we all anticipate, as the humidity is lower, droplets stay airborne longer. As humidity is lower, our mucous membranes are more permeable or more open to getting infectious particles and having us breathe them in. So it's a real important time for us just to stop for a second. And as we celebrate the great service that we see from our military, from our own state National Guard, that we could not, any one of us could not be prouder of the work done by these committed professionals, it is time for each one of us to answer that same call to service. It's really interesting that recently a observation study has come out that said that the island of Taiwan, which is 23 million people that have very tightly adhered to mask wearing and distancing and testing, showing up for testing, as the governor has really instructed all of us to do, they have about 500 total cases, their whole experience with COVID-19, and they have 7 deaths. And while we are not isolated in the same way that Taiwan is, it just tells us that if we are able to really serve each other and commit to the discipline, even though we're tired and even though it's hard, to wear masks and stay distance and to do all the things that we know are going to protect each one of us from getting COVID, from spreading COVID, and protecting the vulnerable citizens in our state and protecting our healthcare systems so we don't get overwhelmed, so people don't die unnecessarily from the disease or from the impact of the disease on our hospital system, then we are going to be the place in this country that people continue to look at and say, wow, how did they do it? How did they do it? And we will say at that time, we did it because of our people. We did it because of the service and the altruism of our people. And we see that happen at the military level. Well, it's time to have that happen at the civilian level. So it is our time, West Virginia, and we need to answer the call together, because if we don't, I am very worried that dark days are coming. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go back to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Significant focus continues on testing, PPE, and sanitization. Yesterday evening, I had an extensive conversation with the governor reference testing. He was very passionate about the great work our local health departments, our DHHR, and our National Guard have done today. But I think he was even more passionate about the fact that he was going to have to ask the Guard one more time to step it up another notch and to help our local health departments, our DHHR, and to push National Guard assets, more extensive National Guard assets, into not just orange and red counties, but also gold counties. It was pretty clear in the direction that I got for the National Guard last night. Our organization has met this morning. We are going to continue to work with schools, with clinics, with pharmacies. Our DHHR team is continuing to build those assets as well. But again, the governor was exceptionally passionate last night in his comments to me in our discussion that we've got to, as Dr. Marsh just stated, we've got to step it up another notch. And we're going to step it up another notch. We're adding additional assets at the governor's direction. We will be working hard in all of our orange and red counties and now in our gold counties to provide additional augmented testing support to continue to focus our communities on getting out and doing the things that we need to do to address this surge that we are facing as a nation. Thank you.
All right, thank you, General. Dr. Ayn Amjad, our State Health Officer, and Bill Crouch, Secretary of the West Virginia DHHR, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you expand on what you said about the pharmacies, Walgreens and Fruth, not being able to handle the capacity? So it sounds like we have too many people going to the pharmacies and not enough people going to the free testing sites. Is that right?
No, not necessarily. From what I am told, you know, and I don't know that this is the case at all Walgreens, but from what I was told the other day, you know, one of the Walgreens said we can only accept 36 cases a day. You know, well, you know, the net of that is just this, Charles. They can't. I mean, they're doing it as a drive-through basis and everything, and they can only handle just so many a day. You know, and we really appreciate what they're doing. And the same way with Fruth and everything, and what they're doing is great, but Charles, we're just not getting there. I mean, when it really boils right down to it, you know, if you've got a county in the state of West Virginia and we show up and we do free testing from 1 to 5 o'clock, and it's in one area of the county, you've got people that are, you know, first of all, they can't get there from 1 to 5 o'clock, and second of all, you know, it's maybe a long drive across the county and everything. We've got to make it more accessible. Now, we've done this, and you know, and don't get me wrong, you know, our National Guard and our pharmacies and our universities and all the health departments and everything, we all know how hard everybody's worked. But that's just not good enough for me, and that's just all there is to it. You know, and that's why, you know, and we started down this path really we got really excited to start down this path and add resources and everything a week ago. Now, in doing so, we really added the resources a month ago, and we stepped up a level, just like we did with Workforce West Virginia. We thought, you know, if we stepped up, you know, on this, you know, to the level that we were at with Workforce, we were going to be able to handle it. Well, we couldn't. And I said, triple it. And then we had to go triple it again. You know, well, now, you know, we stepped up in a great big way, but now we have got another wave coming at us, as does our nation. And with all that, we can't show up in Berkeley County from 1 to 5 one day, and we can't do that. We just can't do it. We've got to absolutely be able to have the capabilities to go not only to our red and our orange counties, because what you're going to do, if you're only able to cover the red and the orange, what is coming to pass is just this with this second wave and absolutely this flu-type season that's causing maybe more and more and more people to become infected. But when you do that and you only are able to go and you're only going to the orange and the red counties, before you know it, what happens is you get those night crawlers in the can and you turn around and look and there's night crawlers from the gold or yellow counties that are crawling out over here, and now they've become orange or red. Well, then all you've really done is change the deck chairs around. And so what we're doing now, and believe me, guys, this is why we kept dollars back from the CARES side to be able to do PPE and testing, because we knew that being prudent and absolutely always having something left, we would be able to cover this. You know, what we have got to do is really step this up. Now, I can't be any more blunt than just to tell you this. You've got people within the bureaucracy, and the bureaucracy could be all government. It could be county health. It could be DHHR. It could be whatever it may be. You've got people within the bureaucracy that absolutely believe, you know, that you just can't do, you can't do more, you can't do this, you can't do that. And at the end of the day, you know, we throw up our hands and we say, and I hate to say it this way, but it's just fact. You know, well, there's nothing I could do. Nothing else I could do. Well, remember what happened to me when I was about 18 years old, standing in front of my dad's desk, and I said, Dad, and I can't to this day, I can never remember what it was. I've tried many times to figure out what it was. I said, Dad, there wasn't anything else I could do, Dad. And, you know, I'm probably standing there just as a kid would dress, and my dad was sitting there, his coat off, but in a tie, his sleeves kind of rolled up a little bit and everything, and his arms as big around at that time as my legs were probably. And I said, Dad, there wasn't anything I could do. And all of a sudden, my dad jumped all the way across the desk, a guy that played a little bit of football for Purdue University and everything, and grabbed me by my shirt and slammed me down on the desk and said, damn you, there's always something you can do, and you better damn well always remember that. Well, I'm going to tell you this. My dad was unbelievably good with me. As my mom, I grew up in an incredible, wonderful home and everything, but I'm going to tell you, that's what my dad would have expected of me. And that's what I expect of us right now. The fact that there's nothing I can do, that ain't going to cut it with me. You know, and really and truly, what we got to do, we got to step it up. We've got to step up our testing, and absolutely our National Guard needs to go, because we're just absolutely in need beyond belief to be able to make it more accommodating. We don't need people driving all over our counties and everything to be able to get to the place to test. Our hours need to be more flexible to be able to get the people through and get them tested. But absolutely, if we get you tested, without any question, you will have these positive impacts. You will absolutely probably be able to get our kids back at school. You will probably be able to have an opportunity to get our kids back on the field or in the court. You will absolutely, without any question, you will identify the people that don't even know they have this, that are spreading this disease, and it just goes around and around and around and around again. It just hurts us from not being in school. It hurts us for not playing ball. It goes around and around, and every day it hurts us, where I sit here and read over and over and over the number of people that are dying. Now, at the end of the day, we're going to provide more and more and more testing capabilities, but what we've got to have from you is not what Dr. Marsh is, or what Dr. Marsh is worried about to not happen. We do not need the Marsh syndrome to be right. And I'm only teasing because I love Dr. Marsh beyond good sense. Absolutely, we do not need you to not show up and be tested. We have got to get you to show up and be tested. It is that important. It is that important for all of us. Please encourage everybody around you to go get tested. We're going to provide the services. You go get tested. Thank you a bunch.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet. I'd like the Governor and some of our medical experts to address my question, which is basically a two-part question. Governor, 5 other states are now starting with similar problems to us, with sharp increases, are starting to issue orders to close down bars and restaurants again. Some are closing down schools. I'm wondering if that is in the mix here. And in particular, I'm asking on behalf of Channel 7 up in the Northern Panhandle at one of our stations, because Marshall County had a 37% infection rate increase, Ohio County 33%. They're wondering, why that is, that they're seeing such a sharp spike in the infection rate up in the Northern Panhandle. And perhaps it's a function of being so closely wedged between 2 other states. But I'm wondering if you're considering shutting anything down given the spike in cases.
First of all, Mark, the reason, probably the reason that we have such a high spike in those counties is we don't have enough people tested. That's probably the underlying culprit right there. I'll take the bet today on that dollar bet or $100 bet. I'll take it today that absolutely without question, if we would have had the numbers tested there, we would not have those percentages at all. But in addition to that, I would say just simply this. I have said it over and over and over. You surely, to the good Lord above, know that you're dealing with a guy that will make the tough decisions and will absolutely act. If it need be, and the good Lord knows, I hope and pray this is not the case. If it need be, we will take whatever actions absolutely are necessary to protect us in every way. There are repercussions from shutting something down. And the last thing on earth I want to do is go that way. But I will. You've seen that I will, and I will if need be.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. We're less than a month away from Thanksgiving, and that's going to be a time when a lot of families get together, COVID or not. Is there a way to do Thanksgiving, maybe not as traditionally as before, but is there a way to do that that would be safer? Is there a design that we could follow? Is there a roadmap we could follow there?
This was Paul, is that correct? Paul, the problem with family settings is just this. In most instances, they are very close with one another, and they're there for prolonged periods of time. And most families, embrace one another and all that. The family setting is probably, in fact, we're being told over and over, the family setting is probably significantly more dangerous than a setting that would be a WVU football game where we've got 20,000 people there. Or an event where we had, 200 or 300 people at outdoor music or whatever that are properly, social distanced, and they aren't up in each other's face, and they aren't there for prolonged periods of time and everything else. from the standpoint of our families, you know, Paul, all I know we can do right now is continue to defer to the health experts, let them tell us more and more guidelines as to what we can do. But the net of the whole thing is just simply just this. A traditional Thanksgiving dinner is Thanksgiving Day, I know is enormously important to all of us and everything. But we're going to have to take every precaution that we can. You know, I think if families would take temperatures as people came in the house, you know, when you're through eating, if you're sitting there watching the football game or whatever like that, if you'd put your mask on, you know, and just do basic, real common sense practices, it would minimize the chance of exposure. But I do know that is an area that is very, very much concern all across this country.
Can I add one thing?
Oh, surely, please.
So Paul, thank you for your question. This is a perfect opportunity for people to get tested before you start to go around other family members. So ultimately, the test is not, you know, the timing, et cetera, can affect the test result. But in general, if you test negative, then you can feel much more comfortable going into that environment. And we really do, as the governor said, want to suggest that you keep this to really small groups and people that are around each other, you know, all the time as much as possible. But getting tested before you go is another good way to start to reduce the risk of coming around each other.
All right, thank you. Paul, Governor, I'll turn it back to you.
I want to go back to Dr. Marsh just one second. Great thought. Great thought. I mean, let's just think about that, really and truly. You know, again, another motivator to go get tested. You know, a motivator to not only protect you, but protect your family, you know, and give you some level of peace of mind. You know, that if you have an event or whatever like that you're planning to go to and whatever like that, and you can get tested, that's wonderful news and everything. And again, you know, Dr. Marsh just shows us all how smart and how forward thinking he really is, and how much he's really concerned about all of us. And so I would highly recommend you follow up on that. And one other thought real quick on that is just this. If you see that we're testing, let's say per se in Berkeley County, and you just happen to live in Pendleton County, or you're in Hampshire County, or wherever it may be, and we're not testing maybe there today, and you have the day off and everything, and you want to take a beautiful drive and everything, you can go to Berkeley County and be tested. You don't have to be a resident of that county. You can go to that county and be tested. So it may take a little extra effort. It may, you know, to be able to cover all. We're going to try to make it so much simpler and so much easier for everybody. But, you know, if you have a desire, you know, something coming up or whatever like that, and you want it, or you think you have any need whatsoever to be tested, you know, we're going to be testing all over the state. You just need to be aware that it is okay to cross a county line and be tested. But nevertheless, you know, I can never thank enough, you know, our you know, Sergeant Major, you know, and you know, Sergeant Major Cantrell. I can never thank the Guard and all their efforts to step up. You know, all the people that received, and I want to make sure that this is right, the Freedom Awards, you know, from our Homeland Security today, you know, Roger Bryant, Lou Vargo, Tom Hart, Laura Peace, Dean Meadows, and Walter Middle, you know, and so many more that are unsung heroes. But, you know, Sergeant Major, we hope and pray your retirement will lead you not far away. We want you right back with us all the time, and And so thank you for all your service, and thank you for all the goodness that you've brought each and every one of us. And so with all that, I would just say, you know, where I've said before, wear your mask, wear your mask, wear your mask. I'm going to switch just a little bit to go get tested, go get tested, go get tested. Thank you so much. Appreciate you.